Good morning, everyone, and thank you for being here on time. My name is Vincent Sweeney. I'm the Acting Resident Coordinator for the United Nations in Jamaica, as well as some other countries of the Northern Caribbean. I'd like to start off by recognizing members of our head table, Dr. the Honorable Christopher Tufton, Minister of Health in Jamaica, other partners from the Ministry of Health, obviously, the Honorable Harjit Sajan, Minister of International Development for Canada, Your Excellency Amina Tadukovic, High Commissioner of Canada to Jamaica, as well as staff of the High Commission and other representatives from the Government of Canada who are visiting as well, Mr. Andres Perez, Chargé d'Affaires, Embassy of Colombia to Jamaica, and other members of the Diplomatic Corps, Dr. Ciro Ugarte, Director of Health Emergencies, Pan American Health Organization, PAHO WHO, Mr. Vicente Terran, Country Representative ad interim for United Nations Children's Fund, UNICEF, Jamaica, Mr. Ian Stain in the audience, PAHO WHO Representative in Jamaica, Bermuda, and the Cayman Islands, other members of the UN country team, other members of the UN, representatives from the Caribbean Public Health Agency, CARFA, which has a special place in my heart, and I can tell you about that at some point, members of the media, others in the audience, and as well as our viewers online. It's a great pleasure to be with you this morning and to welcome you to the launch of Canada's Global Initiative for Vaccine Equity, known as CanGIVE here in Jamaica. CanGIVE is well needed. It's a value add to Jamaica's public health response and immunization program. And so I want to use this opportunity to commend the Government of Canada through the high-level representatives as well as the High Commissioner and others here for your commitment to the Sustainable Development Goals and achieving Agenda 2030 through strong multilateral and bilateral relations. Throughout the COVID pandemic, Canada has demonstrated leadership in its support and contributions to the UN COVAX facility, as well as in providing vaccines and technical and financial support through bilateral agreements with countries like Jamaica. Today's initiative is only a part of this ongoing work. Minister Sajan, we welcome you to Jamaica. And on behalf of the UN Development System and the people we serve, we kindly convey our gratitude to the people and Government of Canada, and indeed Prime Minister Trudeau, for their unwavering support. Colleagues, I would ask you to join me in giving a round of applause for this support from Canada. Through this financial and technical support of the CanGIVE initiative, we have a greater chance of ensuring that the pandemic transmission curve is brought under control and vaccination rates are increased. This is a strong complement to UN and other partner efforts within this health response. PAHO WHO and UNICEF have been two of our lead agencies at the forefront of Jamaica's COVID response and recovery, working to improve quality coverage and universal health access through sustainable health system strengthening. I wish to acknowledge my colleagues, Vicente Terran, Acting Representative of UNICEF in Jamaica, and Ian Stain in the front row from PAHO WHO, the PAHO WHO representative, for their commitment to co-implementing this initiative. Finally, I wish to add to the many commendations of Jamaica's early, quick, and effective approach to its COVID-19 response and recovery. Through partnerships, support of the development community, and strong leaders like Dr. Tufton and his Chief Medical Officer, Dr. Bessessa McKenzie, Jamaica's response continues to be commended around the world. This program, we hope, will give Jamaica the supportive nudge to accelerate its efforts and broaden its immunization agenda. Ladies and gentlemen, colleagues, today's initiative is responsive to the UN Secretary General's Common Agenda and its call for greater collaboration as the key to solving common challenges. Truly, this is the greatest lesson of the last 2 years. Jamaica's future and the future of this region of developing states depends on our ability to trust and work together as a global family to achieve common goals. No community or country, however powerful, can solve its challenges alone. There is undoubted evidence that there is a direct relationship between the safety, security, welfare, and health of the children and people in Jamaica and the children and people thousands of miles across the waters. This reality requires our fresh ideas, modern approaches, and collaborative initiatives like CanGIVE that will see us improve health outcomes for Jamaica and countries like her. Thank you for joining us in this program's launch, and a special welcome to you all. To speak to you now and share more about this signature initiative is one who knows it best. Her Excellency, Amina Dudakovich, High Commissioner of Canada to Jamaica. Please welcome her.
Thank you. I feel you've now raised expectations, but the Minister will be giving lots of details. So good morning, everyone. Special welcome, of course, to Dr. Christopher Tufton, Minister of Health and Wellness. We also have, of course, Dr. Ciro Ugarte, from the Director of Health Emergencies from the Pan American Health Organization. Thank you, Vincent Sweeney, for the warm welcome and acting as our chair and acting as UN Resident Coordinator, Vincente Terran, acting UNICEF rep, of course, Dr. Stein, PAHO and WHO representative to Jamaica, Bermuda and the Cayman Islands, Mr. Andres Perez Rodriguez, who's the Chargé d'Affaires at the Embassy of Colombia, and of course, Dr. Mackenzie, the Chief Medical Officer here in Jamaica. A warm welcome to you all. So thank you as well, of course, to the International Seabed Authority hosting us here in this building. And again, welcome to all our partners on behalf of Canada. Canada has been a leader in the international COVID-19 response since the onset of the pandemic through its early and continued support to COVAX, the COVID-19 vaccine global access facility, as well as support for research and development, testing, treatment, and health system strengthening. I've been really pleased to be here the last year and a half where we've had concrete examples of this partnership, including through the sharing of vaccines, the provisions of personal protective gear, and other things to strengthen the Jamaican health system. The project the Minister will be discussing today exemplifies that leadership and Canada's long-standing commitment to global health. So it is indeed my pleasure to introduce the Honourable Harjit Sajjan, Canada's Minister of International Development, to deliver opening remarks. Minister Sajjan has been a passionate advocate for a coordinated, multilateral, and holistic response to the global COVID-19 pandemic since becoming Minister of International Development in December of 2021. This includes the Minister's work, as mentioned previously, as co-chair of the COVAX Advanced Market Commitment Engagement Group alongside ministers from Indonesia and Ethiopia to support equitable access to vaccines for all countries. We're so thrilled to have our minister here in Jamaica to make this important announcement here in person that will benefit Jamaica, the region, and countries across the globe. And of course, following the minister's announcement, we'll hear from Mr. Vincente Terran, who's the acting country representative for UNICEF, and Ian Stein, PAHO, and WHO represented Jamaica. And I have to say, when this project was just a glimmer, both Dr. Stein and the UNICEF rep who just left a few months ago were passionate and silent prodding advocates for this project. So really glad to see it come to fruition actually quite quickly and looking forward to see the benefits here on the ground. And so with that, I'll turn it over to Minister Sajjan. Thank you.
Thank you, Mina, and thank you very much for the introduction and setting the stage for this very important announcement. Dr. the Honorable Christopher Tufton, Minister of Health and Wellness, Dr. Ugarte, Director of Health and Emergencies for Pan American Health Organizations, Mr. Vincent Sweeney, the Acting UN Resident Coordinator, Mr. Train, the Acting Country Representative for UNICEF and Jamaica, and Dr. Stein, PAHO and WHO representative to Jamaica, Bermuda, and the Cayman Islands. Mr. President Rodriguez, Charge d'Affaires for the Embassy of Colombia to Jamaica, and Dr. Mackenzie, the Chief Medical Officer for Jamaica. I want to acknowledge all your presence and thank you for all the work that all of you have done. And I also want to just take this opportunity, as we talk about CanGIVE, I want to take this opportunity to thank all the officials, not only at our High Commission, but also Global Affairs Canada, who worked tirelessly to work on this initiative, to making sure that Canada did its part to support people all over the world. And that's, so when I give this announcement, I am literally speaking on their behalf because of the work that they have done on this and the heart and soul that they have put into this work. So I'm here to speak to you about Canada's commitment to equitable access to COVID vaccines and strengthening health systems. And the key word, strengthening health systems, something that we need to remember and continue. Now, I was reflecting a bit on today's event, and I realized that while COVID has dominated much of our lives over the last 3 years, the pandemic, unfortunately, has slipped a bit from the headlines over the past few months. It's good to see that our lives are getting back to normal, but we need to remember that COVID is still here. Although we may wish that we could turn the page on COVID altogether, we know that that is not just a simple thing to do. There is still work to do to control the spread of this virus, to move into recovery, and to build stronger health systems. Now, when the pandemic began 3 years ago, governments in Latin America and the Caribbean region acted very quickly to slow the spread of the virus. But at times, gaps in healthcare and social protection systems have made it a struggle to provide care for everyone. And today, health systems everywhere still face big challenges. Now, at home in Canada, over the past few months, we have seen a surge in influenza, RSV, and also COVID. Now, that has put a serious strain on our health systems. And I know that across the continent and around the world, that we have witnessed similar moments during the pandemic when health systems have become overstretched. Now, through it all, we have benefited from the great resilience of the frontline healthcare workers. Now, healthcare workers are responding to surges, delivering regular services, working on COVID prevention and vaccination, and catching up on things like routine immunization for children. And they continue to move mountains to care for our communities. Now, we have also benefited enormously from global efforts to create safe and effective COVID tests, treatments, and vaccines. Now, to date, over 13 billion doses have been administered, and each day, over 2 million people worldwide roll up their sleeves for a COVID vaccine. And we have benefited from partnerships with trusted partners like UNICEF and the Pan American Health Organization. Canada's support to the Pan American Health Organization has helped deliver vaccines to vulnerable populations throughout the region, including women, refugees, and Indigenous peoples. Now, this support has helped strengthen the cold chain to support and transport and store vaccines and share the health messages within communities. Now, partnerships like these are essential for building a healthier, more equitable future that leaves no one behind. Now, while global vaccine equity has not been perfect, it is truly remarkable that there are now more than enough vaccines available to protect everyone. And this is very good news, especially for people who need that protection the most. And yet, ensuring that that those vaccines reach people at high risk remains a challenge. Now, that's where the next phase of our work comes in. Now is the time to connect with communities, to understand the unique barriers that they face. And now is the time to strengthen delivery and distribution systems so that the vaccines can get into people's arms. Now, I know that people in this room and healthcare workers across the country are dedicated to increasing vaccination rates, particularly among the most vulnerable within our communities. And right here in Jamaica, just over a quarter of the population is vaccinated. Now, bolstering vaccination efforts and building trust and confidence in vaccine safety will be essential to increasing the coverage for those who are most at risk. Now, Canada is committed to working with you and across Latin America and the Caribbean to support these efforts. Now, that is why today I am announcing an allocation of $45 million to the Pan American Health Organization and $70 million allocation to UNICEF. And these commitments are part of a signature program called Canada's Global Initiative for Vaccine Equity, or CanGIVE. Now, through CanGIVE, Canada is supporting vaccine delivery and distribution in 12 countries. The funding I have announced today will strengthen health systems and pandemic preparedness in the region, particularly in Colombia, Haiti, and right here in Jamaica, where over $4.7 million will go to the Pan American Health Organization and more than $5.5 million will go to UNICEF in support of Jamaica. Now, Canada's partnership with the Pan American Health Organization will help improve access to COVID vaccines, especially for people in vulnerable situations, including women and girls. Canada's funding will also help improve vaccine surveillance and support health workers. Now, working with our longstanding partners at UNICEF, we will help to make sure COVID vaccines are delivered and distributed equitably to those who are most at risk. Our partnership will support primary healthcare systems as they integrate COVID vaccination into their programming, and it will also provide water, sanitation, hygiene services that are gender sensitive. Critically, our partnership with both organizations will support targeted community engagement to build more support and confidence in vaccines. And building stronger health systems has long been a priority for Canada's international development work, which we are very proud of, including in Latin America and in the Caribbean. Maintaining vaccination programs and ensuring that they respond to the needs of women, girls, and other marginalized groups is essential to our efforts. Now, because we know that ultimately vaccines do not do any good sitting in vials. It takes a health system to turn vaccine into vaccination, and that's something that we are focused on. So once again, I'm hopeful that the commitments that I've announced today will be useful, and once again, before I close, I want to take this opportunity to thank all healthcare workers in Jamaica for the tremendous work that they have done. Merci beaucoup.
Thank you very much, Minister. Before I introduce Vicente Terán, I was just doing a quick calculation in my head, and I hope I'm not that senile that I wasn't able to add up the numbers, but it seemed like he said something in the region of over 10 million Canadian, which converts to about, well, more than a billion, B, not M, a billion Jamaican dollars, and I think we really should be giving the Canadian government another round of applause for that. And that's for Jamaica, from what I understood. I'd like to invite Vicente Terán to bring his remarks from UNICEF. Over to you.
Mr. Vincent Sweeney, Acting UN Resident Coordinator, Dr. Christopher Tufton, Minister of Health and Wellness in Jamaica, Honorable Harjat Sajjan, Minister of International Development, Canada, Her Excellency Emina Tudorwig, High Commissioner of Canada to Jamaica, Dr. Ciro Ugarte, Director of Health Emergency, PAHO WHO, my colleague Ian Stein, Country Representative for PAHO WHO, Jacqueline Visasor McKinsey, Chief Medical Officer, Minister of Health and Wellness, other distinguished ladies and gentlemen, good morning to all. I have the rare pleasure today to represent UNICEF at the country, regional, and global level, and I'm very pleased that this happens to this significant launch that is so important for Jamaica. UNICEF appreciates very much the generous donation of 70 million Canadian dollars received from the Government of Canada. The funds will be used to support the decrease of COVID-19 related mortality and morbidity of populations in 12 countries, including Haiti, Colombia, and Jamaica in Latin America and the Caribbean, with a special focus on vulnerable priority groups. As we are all aware, the COVID-19 pandemic has been the great social challenge of our time. Its impact has been deeply profound, disrupting critical services and leaving countries with long-lasting consequences on the health and well-being of children, women, and communities. Investments that support the COVID-19 response made by both governments and donor partners have the potential and duty to strengthen primary health care and ensure that systems are prepared to address future health shocks, bringing countries closer to realizing Sustainable Development Goals 3, as you remember, is good health and well-being for everybody. For that reason, we are very pleased that this generous donation by the people of Canada will not only allow to increase equitable access to an uptake of COVID-19 vaccines in 12 countries, but also will strengthen gender-sensitive primary health care services, including routine immunization and water and sanitation hygiene systems, which will help the 12 countries to be better prepared to respond to future public health emergencies. In Jamaica, UNICEF interventions will build on a solid foundation of support to the government over the course of the pandemic, as the country transitions from managing COVID-19 as an acute global emergency towards integration and strengthening of primary health care to be more resilient to future challenges. This very timely donation will allow UNICEF Jamaica and the Ministry of Health and Wellness to continue the work initiated with the development and implementation of the digital COVID-19 vaccination information management system and the establishment of an oxygen plant at the St. Anne's base hospitals. The funds will allow for the expansion and modernization of the immunization program in a number of areas and ensure greater access for Jamaicans, as well as greater efficiency for the hard-working public health workers who have capably steered us through the past 2 years. And I'm very pleased to have a representation today with us, and I think they deserve a big round of applause for all the hard work over the last 2 years. We are also honored to work very close with our partner, PAHO WHO, in support of the Health Ministry's ongoing efforts to engage vulnerable groups, ensuring that they are well informed and able to protect themselves, since we continue to face the fact that the pandemic is not yet over. In closing, once again, I acknowledge and thank the government and people of Canada for their generous support to the COVID-19 pandemic response, including vaccines, therapeutics, and health system strengthening received since the onset of the pandemic. UNICEF stands ready to work with our partners to ensure a successful implementation of this initiative. Thank you very much.
Thank you very much, Vicente. I would also want to acknowledge, as has been mentioned already, the hard work of Mariko Kagoshima, the former representative of UNICEF who left a few months ago, and certainly she deserves credit alongside the rest of her team for mobilizing all of the support that UNICEF has been able to generate for Jamaica as well as others. I was very happy as well to hear that the support includes issues such as water and sanitation and the movement towards environmental factors that affect human health. That's a bit of my background, so I'm making a little plug for environmental health, and I see Peter in the front row is one of the people who is going to stand in my corner. And in that regard, I'm very pleased now to invite Dr. Ugarte, who has a similar background and certainly for all of the years that he's been working with PAHO and at the national level in Peru, would be keenly aware of the importance of this contribution that's being made by the Government of Canada. So please welcome Dr. Ugarte from PAHO WHO.
Good morning. Good morning.
Good morning.
Hello. It's a great pleasure for me to be here. This is a quite important event, but also it is show how we together can build big things for the population of the world, and particularly for the population of Jamaica and the Americas. I would like to highlight the importance of this event, but also highlight the presence of Minister Christopher Tufton, a very good friend of PAHO, a key actor in most of the developments of the policies in the region, and being in Jamaica also together with Dr. Jacqueline Bisasor-Mackenzie is a great pleasure, and also, of course, all the colleagues in Jamaica. Honorable Harjit Sajjan, Minister of Technical Cooperation, International Development of Canada. It is also a big pleasure to be here with you. We've been talking regarding all the cooperation that we had together with Canada, and the partnership goes from the technical aspects, but also on the financial aspects and many other aspects that we built together through all these years. Canada has been one of the biggest contributors to the strengthening of the Pan-Americanism and the solidarity, and this is one of the areas where we show that this Pan-Americanism is a reality. And thank you for that support, and looking forward to implement on the benefit of the peoples of the Americas. Honorable Emina Tudakovic, High Commissioner of Canada to Jamaica, it is very important to have those minds, hearts, and feet and hands on the ground to build this type of initiatives, and working together with all partners, key partners, together with the countries, together with the international organization, but looking always for the people in need. That is really excellent. Mr. Vincent Sweeney, actor UN resident coordinator. It is also a great pleasure to work with the UN in general, and this is a way to look at how we in the UN, with other international organizations, can also build that collaboration that sometimes inside the house is challenging. But looking at this special project and looking at how we're developing all these processes is also highly important. And Vicente Terán, acting country representative of UNICEF in Canada. Together with UNICEF, we have been building a close collaboration, particularly with immunization against COVID-19 in the Americas. But beyond that, in many other initiatives that we are happy to work together, and unfortunately we have both organizations the support of Canada for this very, very important initiative. And I would like also to highlight my colleague Ian Stein, PAHO representative in Jamaica, who has also built this process, although he's relatively new here. He has a huge experience on partnerships and cooperation, and I'm sure that this project, particularly for Jamaica, will be highly successful. I would like to highlight some of the aspects of COVID-19 that have been already mentioned. One of them is that we are not over yet. Everybody wants to get out of COVID-19. But just last month, in the Americas, we had a surge of number of cases and deaths that we haven't seen in previous months. The increase was 28% of new cases and more than 46% of new deaths compared to the previous month. And this is worrisome. And particularly this is worrisome because we should have learned many of the lessons that the pandemic showed us. And those are the type of challenges that we need to look at and probably assess what is our capacity and the capacity of the countries and the capacity of the organizations to deal with these emergencies. And I would like also to mention that I commend the government of Canada for its continued support to the countries of the Americas. This support, together with PAHO, to face COVID-19 pandemic, but also building upon all the cooperation that we had and joint efforts to achieve the health and contribute to the well-being of the peoples of the Americas. Canada and PAHO have partnered to provide access to COVID-19 vaccines focusing on populations in situations of vulnerability in the Americas, and particularly in Jamaica. This partnership has strengthened cold chain operations, which in turn has facilitated distribution of COVID-19 vaccines. And together with the Ministry of Health and Wellness of Jamaica, we have increased operational capacity for the deployment and surveillance of COVID-19 vaccines in the field. And this renewed partnership between Canada and PAHO will continue to strengthen the uptake of COVID-19 vaccines in an effort to protect the most vulnerable population in the region, as you rightly said. And we must leverage this opportunity also to revamp our routine immunization services as a fundamental pillar for a robust, resilient, equity-centered primary health care system that can provide essential services for the entire population. The immunization program along all the Americas and in the world has suffered a lot. And the vaccine hesitancy for COVID-19 has spread also in other areas. And that is a big challenge. Many people are less vaccinated for diseases that we used to have a higher coverage. So this is also another challenge that is on the making, and we hope that we can do that together. And PAHO will continue working hand in hand with our member states with the same resolve that has guided us in overcoming numerous health challenges over the past 120 years. Thank you so much.
Thank you very much, Dr. Ugarte. And I think the announcement speaks for itself in terms of the confidence that the Canadian government has in both Jamaica and the UN system in order to advance this initiative. So we're very pleased to be able to partner in this regard. I'm very pleased right now to have the honor to introduce very briefly the Honorable Christopher Tufton. For those of you who obviously live and work in Jamaica, you would know of Dr. Tufton very well for many reasons, including the COVID-19 pandemic over the past couple of years. I should mention, for those who are not normally in Jamaica, that he has been consistently ranked as one of the best ministers in the government of Jamaica. And beyond that, he certainly has been a calming influence alongside the CMO to the population of Jamaica, including myself and my wife, who sit down religiously and watch the news at 7 o'clock every evening, especially during the COVID pandemic. And we are very pleased that Minister Tufton is, in fact, the Minister of Health in Jamaica. So I'm very pleased to welcome him to bring some remarks. Dr. Tufton.
Thank you very much. Mr. Vincent Sweeney, Acting UN Coordinator and Chairman of these proceedings, the Honorable Harjit Sajjan, Minister of International Development, Canada. Welcome to Jamaica. And I trust that you are not just working, we are a tourist destination. And I understand it's very cold in Canada at this time, so please enjoy it while you can. But we're really appreciative of your being here, and particularly for the great news from your Prime Minister and the government and the people of Canada. His Excellency Emina Tajvik, I'm trying to pronounce. I still haven't figured it out, but it's hard. I look at all these names here and I'm worried that I may be seen as abusing alcohol when I try to pronounce all of them, but I'm getting there. Mr. Vincent Teran, Acting Country Representative, UNICEF Jamaica, Mr. Ian Stein of the Country Office, Pan American Health Organization, my own CMO, Jacqueline Beseso McKenzie, and her team. I see some healthcare workers here. Always a privilege to take you off the front line to sit in these proceedings. Show of really appreciate your efforts. Other specially invited guests, ladies and gentlemen, very pleased to be here this morning, and it's a good way to start 2023. I think that this news and what we are embarking on, what it represents both tangibly and symbolically, is very positive and in the interests of healthcare. Indeed, I never imagined that I would have as a captive audience the entire critical UN agencies, the UN, PAHO, UNICEF, and of course one of our most significant bilateral partners, not just in the Americas, but in the world. And at the same time, such good tidings of good news and support. So it is very, very significant, and I want to thank you for this occasion. Jamaica continues, of course, to emphasize the take-up of the COVID-19 vaccines, as well as to strengthen the routine immunization program and the primary healthcare system. The first is clearly justified by what has just been said. The COVID-19 pandemic is still very much here. The virus is still a threat. And indeed, it has to be worrying to all concerned that we're seeing a reemergence of infection rates, hospitalization, and as said earlier, of deaths. The other two, which is strengthening our routine immunization program and the primary healthcare system, or building resilience, is fundamental, a fundamental objective. And from that perspective, very grateful for this program. It's fundamental because COVID has taught us that we're fighting against not just a virus, but either ignorance of the importance of immunization or downright resistance because of a lack of understanding or otherwise of how critical that is to human development report. I pause to recognize Professor Figueroa, who is a champion in that regard. We're very proud of him as a Jamaican, and he works at the global level in this regard. And I remember listening to a presentation he made, I think it was late last year, Prof, at the CARFA conference, when he gave a history of immunization. And the worrying conclusion from that was that in the Americas, not just Jamaica, there was a declining rate of take-up. I believe in the Americas closer to 80%. We're a little higher than that. And if you juxtapose that against the historical significance of immunization and what it has contributed to human development, clearly we have a lot of work to do. And it's not just about a virus. It's about a belief system that we have to champion. And in that regard, the partnerships are critical. So with that in mind, I want to recognize and thank the government, the people of Canada, for the CanGIVE initiative, Canadian 115 million. And yes, if you put it in Jamaican terms, you move from M to B. And that does sound better. So next time we'll just put over $1 billion Jamaican in bracket. But a very big contribution which will benefit Jamaica, and based on our partner agencies in the UN system, will benefit the region and send the appropriate signal around achieving those objectives on all fronts. This collaboration involves, of course, our long-standing partners, PAHO and UNICEF, and it is very important that this toolkit of cooperation and collaboration enhances the critical objectives around vaccination, firstly as it relates to COVID, but critically around strengthening our health systems, which we need as a lesson coming out of this COVID experience. Almost 2 years since COVID-19, we have still been struggling here in Jamaica as it relates to the take-up of the COVID-19 vaccines, with approximately 27% or so take-up. That's way below what we would want, and clearly the implications of that are worrying, not just for COVID, but generally for immunization. It does need significant analysis, and I say this as a challenge to our partners, even while we express great gratitude for the contribution, that this is a signal that we all have to continue and strengthen that collaboration, firstly to understand why this resistance exists, and whether it is a situation of education, because I do believe that parts of our population have forgotten some of the threats that we have had to overcome using immunization, or it's because we need to be more vocal in promoting immunization, because the voice of the anti-vaxxer have gotten louder with alternative media, with greater resources and so on. we have to now make that call, and that call has to be lodged right in the front and center of our minds, and that partnership has to be strengthened in that regard. And this is what this initiative is doing, which we are very grateful for. Jamaica has seen, for example, an increase in our COVID-19 positivity rates, in keeping with what was just said, maybe not as high as other countries, but we saw up to the end of December 6.5%, up to January 10th, just during the Christmas, or just before the Christmas, we were at 4.5%, which obviously means we're moving in the wrong direction. We're keeping a close eye on it, but again, it is a challenge which we have to champion. COVID-19 therefore remains a threat, and we must take advantage of the tools that helps to neutralize that threat. And as we have all agreed, vaccination represents such. We need to continue to renew our message, target specific populations, re-educate on healthcare workers, and equip them with the knowledge and resources to reach more persons and save more lives. And so these funds under the CanGIVE initiative is indeed timely. It provides well-needed boost to our initiatives, new energy to increase awareness, and hopefully to let Jamaicans and those in the region recognize the importance of these efforts. What is appealing about this initiative is that at a time when we recognize that our overall vaccination programs are losing momentum, the 5 components of the initiative speaks to the strengthening of health systems, not just for COVID, as said earlier, but of vaccinations generally. That COVID emerged at a time when the country and the region were and continue to see declines in immunization rates for vaccine-preventable diseases remains that significant a challenge. And so attention must be given to that. Now, just by way of historical context, not just for this audience, because I suspect I'm preaching to the converted here, but to the audience who may be listening on, Jamaica has had a very strong history with immunization programs since its established or expanded program of immunization in 1977. At our last case of polio was in 1982. Last case of locally transmitted measles in 1991. Last case of diphtheria in 1995, rubella in 2000, and newborn tetanus in 2001. And I want to use the opportunity to pay tribute to those who have led that charge, and certainly our frontline workers who have been out in the field to get whether mothers or citizens or members of the population engaged to have achieved those objectives. Our immunization regulations were promulgated in 1986 and updated in 2013, but at this time we're still struggling in a number of areas, which is why I call for the renewal of effort and why this initiative helps us to focus on that. In 2019, for example, we met the target 95% for only 1 out of 10 antigens given in the childhood vaccination program. 2020, we met the target for 7, but again in 2021, we met only 1 target. We know, therefore, that there are children who have not received their vaccines, which provide protection against diseases including poliomyelitis, measles, mumps, rubella. And in a sense, we are using this opportunity and part of this very critical support to do a mop-up to see to what extent we can catch those who have not been caught in the initial thrust. And in the weeks to come, we intend to announce a new initiative that will seek, with your support, to re-emphasize and refocus the attention of the population around the value of immunization and hopefully provide greater incentives, motivations for all concerned, parents and others, to participate in that program. More will be said about that in the future, but for now, I want to say that this partnership will give us greater impetus and energy towards that end. CanGIVE promises strengthening capacity among healthcare workers to deliver COVID-19 vaccine through, among other things, improved policy and human resources. It also takes a broad gender response approach to improve the ability to develop rights, respecting information systems, digital platforms, or surveillance to create a more holistic package. These are together with the improved capacity for public health experts to build evidence on vaccination uptake and existing barriers, in addition to the enhanced capacity to implement gender-responsive and differentiated outreach, risk communication, and the community engagement intervention. This, therefore, represents for us a very big opportunity, not just the resources, but the ability now to engage and to generate as much participation as possible. I close in saying a big thank you again, but also to encourage us as a country, but as a region, given that I have the captive audience of PAHO and others, to redouble our efforts to strengthen that partnership around building back the type of health systems and value systems around beliefs in the immunization program. And I salute and recognize Canada because, in a sense, you are providing the leadership and the platform for that kind of discussion to take place. And we expected that because you've always provided that kind of leadership. Thank you very much, and good luck to all as we embark on this journey.
Thank you very much, Dr. Tufton. We're pleased to be able to invite one of the better recognized performing companies in Jamaica, Ashe. I'm not sure if they're ready yet. Can I get a signal? Yes. I believe they're ready to perform for us and for our Canadian visitors. Please welcome Ashe Company.
You'll be in a world of pure imagination.
Take a look and you'll see into your imagination.
We'll begin with a spin, traveling in a world of my creation.
What we'll see will defy explanation.
And if you want to view paradise, simply look around and view it. Anything you want to do it, want to change the world, there's nothing to it. Oh, oh, oh. Imagine love, everybody. Imagination. 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 We need love. Spreading love. Oh yeah. Imagine there's no heaven. It's easy if you try. No hell below us, above us only sky. Oh, oh, oh. Imagine all for today. Oh, just imagine. Yes, just imagine. You just imagine. Oh, just imagine. Oh, yes.
Imagine there's no country. It isn't hard to do. Ooh, nothing to kill or die for, and no religion too.
Imagine all the people. Imagine all the people. Oh, yeah. You may say I'm a dream.
But I'm not the only one.
I hope someday you will join us. Okay.
And the world will live as one.
Just imagine. You imagine. Just imagine. Oh, just imagine. Just imagine. Oh, yes. Imagine there's no country. It isn't hard to do. Nothing to kill or die for, and no religions do. Oh, imagine all the people living life in peace. Living life in peace. Oh, you may say I'm a tree,
But I'm not the only one.
someday you will join us.
And the world will live as
Oh,
one.
you may say I'm a dreamer.
But I'm not the only one.
I hope someday you'll join us.
And the world will live as one.
Yeah. So we're glad for this partnership with Jamaica and Canada. So let's continue to enhance this system. Imagine living in a world where there is no war. How about that? Yes. And imagine that everyone you see knows what we living for. Yeah. Give us some face. Hey. What a wonderful world it would be. A world for love and peace. Where no evil can abide, only righteousness and creed.
Yes,
we can do it if we only believe. Yes, we can do it if we only agree. It's your world and mine, your world and mine. It's your world and mine, your world and mine. It's your world and mine, your world and mine.
it's your world and mine.
Your world and mine.
So imagine that everyone could give as much as they like to get.
Imagine that everyone could learn.
Everyone could
to
learn.
show each other respect. What a wonderful world this would be. A world for you and me.
Wonderful world.
Yeah, where even the blind can see and the dead man can hear. Yes, we can do it if we only believe. Yes, we believe.
Yes, we can do it if we only agree.
Yes, we agree.
Your world and mine.
Your world and mine.
It's your world and mine.
Your world and mine.
It's your world and mine.
Your world and mine.
Yeah. It's your world and mine.
Your world and mine. Oh, yeah. You may say I'm a dreamer. Oh, no.
But I'm not the only one.
Oh, someday you will join us and go. imagine,
Just imagine.
love and peace.
Just
Yeah,
imagine.
just imagine. Ashe.
I think we can give them another round of applause. And I'm sure I overheard the minister from Canada indicating how impressed he was with the performance. Indeed, a showcasing of Jamaica's many talents. We are coming to the end of our formalities, and in order to conclude, I'd like to acknowledge, although it's already been done by others, the Government of Canada for this initiative and for the direct and tangible support provided to the government and people of Jamaica through this CanGIVE initiative. And I'd also like to acknowledge the presence of the Minister, the CMO, and others from the Ministry and the Government of Jamaica for making the time to come here and for your continued inspiration and reassurance to all of us here in Jamaica, to my colleagues in the UN and those who supported the organization of this briefing and performance. Thank you very much to the media for your coverage, not only in the room, but those who are viewing online, recognizing those who have supported the broadcasting of this initiative, and to the ISA for providing us with these wonderful facilities. To all of you who have made the time to come down here and to make this a success, thank you very much, and we look forward to hearing all the good things that we know we will hear about this CanGIVE initiative as it unfolds in the next days, weeks, and months. So thank you all, and we have refreshments in the room to the left as you leave the media room. Thank you all very much, and have a pleasant and safe rest of the day and weekend. Thank you.